Swayam Prabha. Digital India. Educated India.
It is a very vast field of its own, especially in research and so on actually. So I'm going to just give you an overview of each of the topics. The first one is related to biomaterials. You have heard of biomaterials? Right? You have heard? You have heard of implants? Yeah, you must have heard. Any example? Anybody can give me? Can you give me an example of an implant? Stent. Stent. Where do you use the stent? Yeah, angioplasty. If somebody had a angioplasty, they would have placed a stent. Why do they place the stent? Blood. Because the plaque covers the blood vessel, doesn't allow the blood. Do you know what's the material it's made up of? Nitinol, correct, yeah. You know, it's made up of, nitinol is a commercial name, but the basic metals. Nickel and titanium. It's made up of titanium and nickel, actually. Any other materials that's used in stents? Okay, leave it. Any other biomaterial?
There is this gel that is being used to kind of reduce the inflammation of pain.
Impression. Is it impression material? No.
It's a gel, polymer gel.
Okay. Hydrogel for wound healing, like, right? Okay. Hydrogels, yes. Yeah, even that's a biomaterial. Braces we use. So what material is that? Any idea? Steel is a very general, colloquial name. That's also made up of titanium. Nowadays, some other material is also coming. If you now go to a dentist, they will give you a polymeric type of braces. It looks like your teeth. Otherwise, it's metallic. No, it doesn't look nice. So it's almost like your teeth. Actually, it's a polymeric material. So they give
Ceramic crowns for.
Yeah, ceramic crowns. When you have a tooth decay, they put any other biomaterial. Hip replacement, yes. Hip replacement, knee replacement. So a lot of materials are used in that actually, because if you look at hip, there is going to be a ball and socket. Okay, so there could be a ball and socket, and then there could be the holder. So there you have chromium, cobalt, polyethylene, so many different types of materials actually. So I'm going to talk about medical biomaterials only, because biomaterials are used in many areas, but my focus is on medical biomaterials. So biomaterials which are used in our human body. Nowadays, many of us seem to be having, even if you have a tooth decay and you have a tooth replacement, that's a biomaterial. Okay. Even if you have the blood transplant, okay, there is a blood bag is there, and then there is a tube coming in. Those are all biomaterials. So some of the biomaterials stay longer in the body, like few hours. Urinary bag. Those who have an operation, they can't get up, go to the restroom, so they have urinary bag. That's all few hours of biomaterial. Whereas if you talk about stents, that's going to be there forever. So you have biomaterials, few hours going right up to the entire lifetime. Hip also. It's going to be there forever and ever. So you have short duration biomaterial, long duration biomaterial, and biomaterials are placed in different parts of the body. Talked about heart, then we talked about wound healing, and then blood bags, catheters, hip replacement, dental. So different parts of the body. You can, even if you have a fracture nowadays, they keep titanium plates and then they put screws there actually. So that's also a biomaterial. So different parts of the body, you have biomaterials being used actually. So if you want a definition, any substance synthetic or natural, because you can have synthetic like polymers, metals, ceramics, or natural. You can go for natural material like chitosan, carrageenan. Those are all also called biomaterials actually. Anything that's going to be there in the body to treat, okay, augment, sometimes it helps. There is something called left ventricle assisted device. So some people, the left side of the heart is the important portion actually, because it pumps blood to an entire body, and that's a bit weak. So it cannot pump blood to all parts of the body. So there is a pump which is kept inside. So it will assist the left ventricle to pump the blood to rest of the body. So even that's a biomaterial. So that is the augmenting as part of the human augment. Diagnose, even diagnose. Nowadays, can I diagnose continuously my blood glucose level? Can I diagnose continuously some toxic chemicals level in my body? Okay, that sort of things actually. So diagnose, replace. Of course, you replace some parts of the body. And now you have artificial ears, artificial nose. Then there are certain surgeries after an accident, trauma. So those are all things which replace. All these are called biomaterials. But interestingly, drug is not called a biomaterial. That is tablet which we take, no? That's not called a biomaterial. But all other things are called a biomaterial. So there is a lot of interest nowadays because after an accident, trauma, even for cosmetic purposes, everybody now likes to look good, feel good. So a lot of surgeries are done, cosmetic surgeries are done where people augment their ears, nose and facials and all that, you know. So even cosmetic surgery, there are a lot of biomaterials being used. In dental, there are a lot of biomaterials being used actually. Two important things are there. It has to be biocompatible because it's going to inside our body. So it has to be compatible to the host. It can't lead to some toxic chemicals, toxicity. That happens actually. Somebody who has a dental implant. So there are metals like cobalt, chromium, nickel are used, and somebody could be allergic to those. So the person may get swelling in the teeth, in the gums, swelling in the mouth. So that sort of things should not happen actually. Okay. So it has to be biocompatible. That's called biocompatibility. It has to be compatible to the person who is going to use that biomaterial. Whether it is hip replacement or whether it is a ceramic crown or a metallic crown in my tooth area actually. And we should also know what will happen to the host. Like I am wearing a biomaterial, I may be having toxic reaction, short term, long term, genotoxicity, nephrotoxicity. So many things can happen over a long period of time also actually. Nowadays people are getting allergic to metals, nickel allergy. People who have, if you remember those days, you know, tooth replacement, they used to have metallic tooth. You must have seen 25, 30 years back actually, metallic tooth. But these metals can slowly degrade and it can be toxic to the host actually. That is why nowadays it's completely gone into non-metallic ceramic based or inorganic based material actually. So what happens to the host? That's very, very important. So we have to do clinical studies, animal studies, we have to do human studies before the material is introduced into the real market. So if you are discovering a biomaterial, just like drug, you have to do all these studies and get approval from the drug controller authority in India or Food and Drug Administration in US before the material is introduced into the market to see what is happening to the host, toxicity, short-term toxicity, long-term toxicity and so on. Okay, I am just going to show a lot of pictures to you to look at. These are called bone plates. So suppose there is a fracture, the bones are broken here, so they keep the bone here and then they have a plate. And many times bones grow if it is less than 2 centimeter. Bones start actually growing. So ultimately it may come and join. So they keep these plates. So these are some stainless steel plates. Stainless steel has disadvantages because any reason why you think stainless steel has some disadvantage? You have heard of stainless steel, right? So what could be the disadvantage? It can degrade. No, metals don't degrade. It can. No, it's got fantastic flexibility. It's very good. It's have high tensile strength. Metals have.
They need to be removed.
No, it does not have to be removed. You don't remove it actually. It gets corroded. Corrosion happens with stainless steel, right? Any stainless steel, even at home, you might have seen. After some time, they get corroded actually. Nickel, stainless steel contains nickel. Nickel may come out, but it's cheaper. So nowadays, titanium-based materials have come because it doesn't corrode. Stainless steel corrodes. So they keep these. They have two broken bones. They keep the plates, and then they put screws here actually. So the bones are kept in line, and then they start slowly growing actually. Okay, these are titanium bone plates. Like I said, titanium doesn't corrode. It's expensive when compared to stainless steel. So in India still we use a lot of stainless steel because it's very, very cheap. Titanium, again same thing, are used to keep the bones here. You can see how the bones are aligned, and then you have the screws here actually. So now what happens? These bone plates, sometimes the bacteria can come and start settling down, and they form something called biofilm. So biofilm is a very serious problem in biomaterial. If there are any bacteria in the blood region, they start settling down on any material. These are foreign material, and they start forming a layer. Suppose you have a plastic bucket at home and you leave some water for 1 or 2 days. If you touch inside, have you done that? You feel very slimy, right? So that's a biofilm. The bacteria in the water start settling down on the metal and the plastic surface, and they start forming exopolysaccharides, proteins, carbohydrates. So it becomes very slimy. Same thing happens in biomaterials. So when a bone plate is kept inside, because these are going to stay for a very, very long time, and the bacteria start settling down, and then that causes biofilm. Once the biofilm starts settling down, what happens is that leads to a lot of infection actually. So that is why what we do is we coat these implants with an antibiotic. As you know, silver nitrate, here in this example we have silver nitrate, which is an antibiotic. Then we just don't coat with silver nitrate, we also use a polymer called poly-L-lactic acid. You have read about polymers, right, in your course, I suppose. All of you have read about polymers, yeah. So polylactic acid is a polymer, so it slowly degrades, it releases the silver nitrate slowly, and silver, as you know, is antibacterial, so it does not allow bacteria to settle down and form this biofilm. Thereby it keeps the surface clean actually. So that is what we do here. Okay, we coat it with a combination of polylactic acid and silver nitrate. Polylactic acid will slowly degrade, and the silver will get slowly released. That's the strategy here. This is a polylactic acid screw. Okay, the screws which I showed you before, yeah, these are the screws. These are all polylactic acid screws. The advantage is these screws are biodegradable. So after a year, those screws will completely disappear. So it's not a metallic which remains there forever and ever. So it will degrade. So the bone plate and the bone will get nicely integrated. So these are all polylactic acid screws, they are called. And these are beads which are made of polymethyl methacrylate. You have heard of that polymer? Polymethyl methacrylate? No? It's a polyester, basically. Okay, so, but these are not biodegradable. What we do is we have some drug inside these polymers, and the drug gets slowly released. So if there is an infection in some area, you keep these beads there, drug gets slowly released, thereby they keep the infection away. So for example, if somebody has a fracture and there is a big opening and wound is there, so bacterial load is very high, so they have to kill the bacteria. So what they do is they put in this polymethyl methacrylate beads, with the antibiotic, and they place it here and close this place, and the antibiotic gets released slowly, and they kill all the bacteria. The wound gets controlled actually. Okay, especially after an accident, there is going to be maybe fracture, there is going to be open wounds. All those things can happen, right? So this polymer is used. But disadvantage of this polymer is it doesn't degrade. So finally, after a year or something, those polymer will be there. All the drug would have come out. Okay, so they have to remove that polymer. That's why they have a string, like, you know, all these beads are connected with a string, and slowly they pull out the string and all the polymer will come out. So we are trying to work out some other polymer which will slowly degrade also. So we don't have to remove that. So the drug gets released and polymer will slowly degrade and disappear. These are some dental examples. Okay, so if somebody had a tooth placed, actually, okay, root canal. Did anybody have a root canal treatment in this group? No, you have heard of root canal? Yeah, you must have. Maybe somebody in your house or relatives must have had a root canal. Okay, so what they do is they place this metal. It's called a post. Okay, so there is a gap in the tooth, so they want to keep an artificial tooth there. So they'll keep this metal post and drill it into the gum. Okay, so nowadays you have different types of metals there. Even gold metal posts are available here, silver and so on. So once they place it there, it will look like that, right? So then they can stick a tooth to that, so you will not be able to see the difference. It will look like a normal tooth actually. Okay, they stick a tooth. I will show you that example. Yeah. So that's called veneer. So if you have seen in TV and movies and all that, no, all the actors, actresses smiling, everything looks white. It's completely not true actually, because they have this veneer which is stuck to their teeth. It lasts for about 3 years, and depending upon the color of the tooth, you know, they have different types of veneer colors. They stick it. So when the actor or actresses smile, you see a very bright smile. The whole thing is because of this type of modification done by a dental surgeon actually. You can see how beautiful they look like after sticking a veneer. So even if you have a root canal, then you stick it there, or if you have something spoiled here, they can, even broken tooth, they can stick a veneer in front. So the your entire smile looks so beautiful. The whole thing is humbug actually. But those things last for about 3 years, and they have to be careful while eating and drinking hot or cold things and all that. These are called inlays. Okay, so there is a infection there. Okay, caries there. So they keep these type of inlays on top, especially on the teeth. That's on the back side of. If there is a bacterial infection, or if there is a damage to that tooth. Okay, these are made up of ceramic. Okay, these inlays are made up of ceramic. Sometimes you can also have metals actually. You can see the metal crowns. Different types of metals are used. Mercury, amalgams, silver, gold. All these are used, and especially on the back side, it doesn't matter for you because it won't be visible. But in the front side, they would like to have some sort of a ceramic so that it matches exactly with your tooth color actually. And braces, of course, metal braces, very common, but nowadays polymer based bases are coming, which matches exactly your teeth hue. So you cannot differentiate that. Composites, filling. So there is you can see a bacterial infection, caries there. So they clean the caries, they'll put some antibiotic there. And then after that, they'll fill it up with the composite. Composite is made up of some sort of cement. It's made up of polymer cement and then inorganic material. So it remains there for a very long time. Unless you try to bite a bone or something like that, it remains there for many years actually. So you can see it exactly matching the color of the remaining teeth. You will not be able to see the difference at all actually. Especially in the area of dental, there are almost 30-40 different biomaterials are used. Metallic biomaterials, polymeric, cements, inorganic, and so many things actually. For example, this, the impression material. They want to make an artificial tooth, and they try to take the impression with a broken tooth or in that area. That's also a biomaterial actually. Amalgam, mercury amalgams are very common. Slowly those mercury based products are going away because of some sort of a toxicity worry actually. So they will try to use some other material. Advantage of mercury, it's very soft, so it can go and fill gaps and crevices in the tooth. So that's a great advantage. No other material is available there. Again, it's a composite crown. The whole crown is polymer. So you see a broken tooth, either it is broken because of accident or it is infected. So they removed all the infection. So they just fit it here. You can see so beautifully the final job done. You will not be able to see any difference there actually. It's a composite material. That means it's got inorganic like calcium sulfate. Then it has got polymer like polyacrylic acid. Polymethyl methacrylate, so that's a composite filling, and the beauty is it can take up changes in temperature and lighting and so on. Actually, as you can see, this exactly matching the hue and color of the rest of the teeth. As I mentioned, veneer. There are different colors of veneer available. So depending upon your rest of the tooth color and hue, they can pick up and stick it to your thing actually. These things last, like I said, 3-4 years. You have to be careful while eating and drinking hot or cold material. But it gives a beautiful outlook, as you can see in this particular case. Look at those two pictures there. So already existing maybe broken tooth or after a surgery where you have done a root canal surgery, they can keep and stick it to that actually. So there are lot of polymeric composites are available which acts as an adhesive gum and stick it to your tooth, rest of the tooth. Okay, there are some especially problems in the dental area because some material, some people may be allergic. Like for example, I may not be allergic to nickel, maybe somebody else may be allergic to nickel because some of the metallic implants contain nickel, chromium and metal, iron and so on. So they could be allergic and they could have a inflammation that can be happening actually. Look at this, the entire area gets inflamed, so that whole material has to be removed, whatever they had put in, and then they may have to place another one. First address the inflammation, pain, if there is infection, then they will address that, and then they may put something else actually. That is one problem, the response of the host to the material. Like I said, I may not be allergic to nickel or chromium, somebody else may be allergic. So same material, that person may be having problem. That is one thing. Other thing is bacteria can start settling down in those places actually, and they form this biofilm. You can see some of these biofilm or biomaterials. These are something called confocal images. Okay, so you can see the green color is live bacteria. So the bacteria can settle down and then start growing. And after some time, a year or something, you may have a pain and so on actually. So that is another problem that could happen there. Okay, the biofilm. The other one is inflammatory response because of the material. So when that inflammation happens, not only the area gets inflamed, pain, but sometimes bones also get lost. That means that whole region, there could be a big gap, the bone, and you can't replace those bones. They use cements sometimes, like I said, polyacrylic acids, some other polymer, which act as a cement and they really bind to that area actually. So they use that and that becomes more bigger job of treatment to the patient actually. But inflammation can happen. Nowadays it's become very common because of the toxicity of the material or the response, allergic response of the material. So in the long run, they would like to have material more of a ceramic based material rather than metal based material. So because like calcium sulfate, calcium hydrophosphates, calcium hydrogen phosphates, that sort of inorganic, which may not cause so much response to the host actually. So the whole world would like to go in that direction rather than using material. Even in bones also, the whole world would like to go instead of using stainless steel and titanium. In bone area, we have another polymer called polycarbonate, which is very, very strong, as strong as metal. And there is a lot of research now going on in that area actually. And polycarbonate is very strong. You have heard of polycarbonate? You have heard of the windshields of cars, which is like a bulletproof cars and all that. So that is made up of this polymer called polycarbonate. It's very, very transparent, as well as if there is a bullet, many times it does not allow the bullet to pass through actually. Okay, these are called urethral stents. So you have the bladder and the kidney, and the urine flows down. That portion is called ureter. Okay, and then it comes out. So that small tube, which is ureter, through which the urine flows, sometimes can get blocked because of stones. You know, people do have stones; it can get blocked, and or infection and all that. So what they do is they keep something called a urethral stent. Okay, it's a flexible polyurethane type of material. So then urine can flow easily. So if there is stone, then it can get dislodged and it will come out actually. So these are called urethral stents. This is made up of polyurethane. So after the surgery and after the treatment, they can remove this polyurethane actually. Okay. But these polymers are not degradable, so you have to remove that. It can't stay inside the body forever and ever actually. There are problems. These are some X-ray pictures. As you can see, urethral stents placed inside the body. What happens is sometimes they break also. You can see here, it can break, but then it becomes much more difficult. The doctor has to remove both sides, like slightly bigger surgery. Otherwise, if it is intact, it's much more easier for them to remove. So one of the challenges is the stent can break into 2-3 pieces. Then the doctor has to really remove that. Okay. That's a polyurethane type of material, number one. Number two, it's not biodegradable, so they have to remove it. It cannot stay forever and ever inside the body. Sometimes some patients say, for example, they have this and they get transferred, they go to some other place, so they forget about it, and after a few years they feel some pain and this discomfort, then they will remember that they have urethral stents. So that sort of problems are there. Another thing is infection. As you know, urine is flowing. Urine has some bacteria. Anybody has done biotechnology in your 11th? So what type of organisms in urine? Anybody who has done biology or biological science? E. coli is one, then? Anything else? You have heard of protease? Protease mirabilis, yeah, that is another one. Protease mirabilis changes the pH, so the salts which are dissolved start precipitating out. That is why people get the salt deposit or the stones, because when the pH changes from highly acidic, this particular organism changes that, so the salts become stones actually. So that is another major organism. These two are major organisms. So the urine has 2-3 organisms, then urine has salts. So that's a very harsh environment. So what happens is the organisms can settle down, salts can settle down, so you can have very solid biofilm. That is another problem if these stents stay inside this, urethral stent stays for a very long time inside the body actually. Because when compared to rest of the portion of the body, the urinary region is much more harsher because of these organisms and because of stones. Actually, the dental region is more harsher because we are biting, say, food, temperatures keep changing with time. When I have ice cream or when I have coffee, there are a lot of enzymes in my mouth which try to degrade the food. So, in fact, the oral cavity is much more harsher. But here it's much more toxic, the urinary region, because of bacteria and stones and so on. And so we have been working on another polymer called PLGA, that is polylactic glycolic acid, which is biodegradable. So can I make stents like that so that they will slowly degrade over a period of time, so that doctor does not have to remove these stents, because the original stent is in polyurethane, which is not biodegradable. Okay, so that's one area where there is a lot of interest, looking at biodegradable polymer. But these polymers have to work like normal stents for certain period, but then later on slowly it should degrade. So those challenges are there. Polyurethane is very good. It is almost like rubber. It will be flexible. In fact, in cosmetic surgeries, polyurethane use. If you look at all these ear replacement, nose replacement, you have cosmetic surgeries. Polyurethane is one common polymer that's being used in the human body, actually, quite a lot. So as you can see the some acknowledgement here. This is Sri Ramachandra Medical College, Chennai, with the urologist. Okay, and we have been collaborating. Similarly, you will see CMC Vellore, Christian Medical Center, that's in Vellore. So we have been collaborating. So if you have to work in the area of biomaterials, you need to have a very good collaboration with the hospital, because the surgeons are with the patients doing the surgery. So you get the real feedback and problems, issues, knowledge from the surgeon. So as a scientist, you may be designing something, but how useful it is, what the patients feel, what are the issues on the patients, that sort of information you can get only with the from the surgeons. Okay, so any biomaterial research requires a collaborative and cooperation with the surgeons who use the biomaterials on patients. So you need to have a collaboration maybe with the engineer or a polymer chemist, then you as a scientist, and then you have the medical surgeon who is going to actually place the biomaterial inside the patient. So this particular area requires a collaborative research. So it's not done alone. If you do it alone, it's of no use, because nothing will come out of the research which you are doing actually. These are, as you can see, total knee replacement. Okay. So you have the knee, you have the ball and socket joint, we have cobalt, chromium, alloys, and then we have another portion which inside which the ball moves. Because they are metal, they keep a polymer which is called a high molecular weight polyethylene, because metal on metal, if it keeps rubbing, slowly the debris will come and slowly they will disappear. So, and pain, there will be a lot of pain also. So they keep a sleeve which is made up of ultra high molecular weight polyethylene, like a lubricant, when this ball and socket moves actually inside the socket. So that white thing is the polyethylene. There is a heart valve, and sometimes babies have problem with the valve, so there is a valve replacement surgery happens, okay, or the valve is spoiled, okay. So they keep, as you can see, you have a small butterfly like which moves as the blood flows, and then this outer ring that is made up of metal, and then the butterfly like is made up of polymer like polyester, polytetrafluoroethylene, polypropylene, and the outside metal is titanium cobalt alloy. Okay, this is called heart valve. There are imported heart valves also is there. Indian made heart valves also there. There is a place called Sri Chitra Tirunal Institute of Higher Medical Science. Have you heard about Sri Chitra Tirunal? Has anybody heard? No? It's one of the best for some of these biomaterials. It's in Trivandrum. The price of these heart valves is almost 1/5 when compared to the imported heart valves, and it works very, very good actually. So they have designed, and it's being used quite a lot, especially countries like India where cost plays a very important role.